Hi, I'm Dr. Anthony Cave, a Stanford and Harvard-trained anesthesiologist and integrative medicine specialist. And in my ketamine infusion clinic, patients describe coming out feeling transformed, incredible, healed from the inside, optimistic, even unstuck. But what is ketamine? It's far more than a horse tranquilizer, and how does it help my patients overcome some of their deepest mental health struggles? We're going to talk about what ketamine is, how ketamine works to heal our mental and physical health, the different forms of ketamine like intravenous versus intramuscular, intranasal, etc., and what the risks of ketamine treatments are. Medicine's greatest secret is our inner healing potential, and it's most powerful under anesthesia, when we let go of the reality we think we know. There are rarely any golden bullets in medicine, and ketamine is no exception. One of the few golden bullets is when we tap into our inner healing potential to heal ourselves from the inside out. And that's what ketamine can do when used properly under medical supervision to help us tap into our inner healing potential. And that's how it helps my patients achieve things they never thought possible before they start their ketamine journey with me. So number one, what is ketamine? Ketamine is thought of as a horse tranquilizer because it's very effective at sedating animals with intramuscular injections. So if you can't get an IV line in an animal, like at the vet clinic or in a zoo, you can do what's called a ketamine dart, and literally dart them with a bolus of ketamine and they can fall asleep. Now, in human beings, we usually use ketamine IV because during surgery or in the emergency room when we're often using ketamine in humans, which we've been doing for decades, like 50 plus years, and very safely, we can better deliver it through an IV line because we have more control over how much is going into the bloodstream and ultimately affecting the brain. But if you've ever watched Jurassic Park or anything before, those darts they throw at the dinosaurs are probably ketamine darts, if the movie was real. So ketamine is actually an anesthetic that we use in the operating room and the emergency room even today because it has powerful properties that are different than other anesthetics, like propofol and anesthesia gases. Most importantly, even at relatively high doses, it still lets patients breathe, which is what makes it so powerful for cases of sedation, when you don't have a breathing tube that would breathe for you otherwise. We believe it acts primarily at the NMDA receptor, which is one of the many receptors in the brain, and affects the activity of glutamate, which is one of the many neurotransmitters in the brain. But realistically, we don't know how ketamine works because it affects so many different receptors all across the brain, and we only know a handful of them. We do know that it's very safe in little kids all the way up to older adults when used correctly at the right dose. And we know that its effects are very dose dependent, meaning that the effects that you get depend on the dose that you're given. The effects of ketamine at high doses are very different than the effects of ketamine at low doses. In particular, if a patient's getting a high dose of ketamine, like for me in the operating room, they might go fully to sleep and be rendered entirely unconscious. If they get a low to middle dose of ketamine, it can help with pain control, such as after surgery in the hospital, without putting them fully to sleep. If they get a low dose of ketamine, it can actually help induce what we call a dissociative state, which can help individuals enter a highly healing space. That's what we aim to accomplish in my ketamine infusion clinic. Getting that right dose, so it's not too far off one end, but it's just high enough to help patients enter that healing space within themselves. Next, what are the effects of ketamine? I mentioned earlier that it can be a general anesthetic because it affects many of the neurons in the brain and it can make you unconscious at high enough doses. At high enough doses, it will actually also turn off the breathing centers of the brain as well. Like I said earlier though, at middle doses, it can actually help give a good anti-pain effect while still letting patients breathe without giving them too many dissociative thoughts or putting them in an unpleasant mental space, like giving them a bad trip. But it's really the lower doses that we're interested in ketamine infusion clinics, and that's because they can help patients revisit themselves. They can help us enter a psychedelic state. At the most basic level, ketamine can be very helpful for any mental condition where we're stuck in a particular mindset. We call this cognitive rigidity. And one of my favorite sayings is how the willow reed can sway back and forth in a storm, but the mighty oak tree snaps its branches because that oak tree is rigid. It doesn't have flexibility to weather the storms that life throws at us. That's when a lot of mental health conditions can arise, either from storms from the inside or storms from the outside. Maybe from our past in childhood, what we call adverse childhood experiences, or at any other point in adolescence, in school, in our jobs, with our families, with our loved ones. The more flexible our minds are, the less likely, often not always, we are to fall into cognitive distortions that can wreak havoc on our mental and physical health. And it's at these low doses that ketamine can help induce persistent changes in self-representation. Really broadly, that means that it changes our relationship with ourself. It changes our perspective of ourself, how we fit in the world around us. And this can be incredibly healing when we're stuck in a place where our perspective is limited, where our focus is inward, where we're perseverating and ruminating over the same topics, either of the past, what we call depression, or of the future, what we call anxiety. Ketamine literally rewires the brain, what we call neuroplasticity. It softens our rigid behaviors, our rigid thought patterns to help us enter healing spaces where we can ultimately tap into our inner healing potential. And that's what makes ketamine a potential silver or golden bullet, because it's something that we can take with us forever after, even after the number of infusions that we do with our doctors. This leads us to how ketamine works by softening us, by softening our mind, our rigid habit loops. When we talk about rigid habit loops, OCD or addiction often come to mind. But anxiety and depression have similar rigid habit loops that we fall into, rigid loops of perseveration and rumination that we find ourselves stuck in. Remember how I said that one of the powerful things that patients say after a ketamine journey is how unstuck they feel, how liberated they feel? They feel lighter, optimistic, at peace, connected. These are all by virtue of helping transition our inward-focused rumination and perseveration towards something with a greater perspective of the outside world. Embracing our connection with the greater world around us, the people in it, the nature in it, the animals in it. There are many ways that we can fit into the world around us that separate us from that inward-focused suffering that many of us fall into. It's not blaming anyone, but it's recognizing the repeated characteristics that so many of my patients have before they start their ketamine journey. PTSD and pain have similar habit loops, and it's not a surprise that ketamine, when used in a holistic manner, in coordination with psychiatrists and therapists, in a compassionate way, can help many patients, even with chronic pain, have a different view of their pain and ultimately escape their pain, even migraines. Ketamine also comes in different forms. Pretty much any form you can think of. We talked about the ketamine dart, which is an intramuscular injection, like it goes into your shoulder here, or it can be orally, like with a lozenge or a pill, or it can be intranasally, like with a spray, or it can be intravenously, like the infusion. I'm going to have a whole different video on the different routes of administering ketamine because they are all quite different. But the gold standard, the most effective, the fastest treatment is going to be through the IV, because within seconds, the ketamine crosses the blood-brain barrier and begins to take effect. That's simply faster than any other form of administration. It's why we use it in the operating room as well, because in the operating room, we need the fastest onset of action for life-threatening scenarios. Now, a ketamine infusion clinic is not necessarily a life-threatening scenario, but when we want patients to reach a healing space as fast as possible, as controllable as possible, the intravenous route is the most effective way because you can directly dial in the ketamine that the brain sees where we believe it acts. And lastly, what are the risks of ketamine? Ketamine can be a drug of abuse when used incorrectly. It's a scheduled drug. You need a DEA license to use it. This is serious medicine, just like many other anesthetics. When used in the right setting, the addiction potential can be very low. However, your doctors do need to be very mindful about what the dosing of the ketamine is, how it's being used, to minimize the risks of it becoming a drug of abuse in the future. This is a serious concern. The most likely risk, however, is not from addiction or from heart or lung problems or from not breathing. Even though those are all possible risks, they can be very low when a trained professional is administering the ketamine, like an anesthesiologist or an emergency room physician. We use ketamine all the time in children and older adults at low doses, at high doses. You want to have a doctor that has that familiarity with ketamine, especially in the IV route, so that you have the safest and most effective ketamine journey. But the highest risk, like I said, is not that. It's from having a bad trip or a bad experience. That bad trip in one of its worst forms can be called a K-hole, where we get so disassociated from our body, we feel that we may never be able to join it again. It sounds very scary because it can be when ketamine is not used with a trained professional, when it's not used with an anesthesiologist or an emergency room doctor who knows how to dose ketamine properly, and when it's not used with somebody who's trained in how to guide a psychedelic experience, to help ensure the individual is able to come out of that hole before they ever fall in, to help make sure that that bad trip never happens. My biggest concern that realistically can happen is that a patient has a bad experience, a bad trip, a K-hole, or any other type of unpleasant, scary experience that turns them off from ever wanting to have a psychedelic experience again, even though it might be so helpful for them in the long run to get off of other medications like SSRIs or SNRIs or TCAs or benzodiazepines, or to curb opioid addictions or other addictions. If we are not careful to help guide our patients through a therapeutic psychedelic experience with ketamine, they may never be able to heal themselves if they're forever frightened of entering that state again. This is why when you are the guide and the physician for an individual having a ketamine infusion, it's an almost sacred relationship. They're vulnerable, just like when they're in the operating room with you. They're trusting you with their life, their consciousness, literally. And we take that so seriously. And when you're looking for a ketamine clinic, you need to find doctors who are board certified, trained in the medicine and trained in the psychedelic experience, so that you know you are in the hands of someone who is truly knowledgeable, expert, and compassionate. This is how ketamine can be the golden bullet that so many of my patients are looking for to help them tap in to their inner healing potentials.